Thank you, Mr. Chairman. And I wanted to take a moment and kind of clear up some of the really misinformation even coming from this campaign. The ranking member has alluded a number of times, along with some members of his side of the committee, that those of us who are saying that public officials should have considered naturally acquired immunity and the data there and the over millennia of scientific understanding about that, that we were somehow advocating for COVID catching parties is absolutely, it's ridiculous, and it itself is misinformation. Using that same logic model, I could claim that they are advocating that the government public officials should be lying to the American people in order to enforce mandates and do other kind of things that happen to keep people out of their profession, to keep medical experts who were speaking to this issue out of their scientific understanding and data, that they should have been banned from big tech and conspiring with big pharma to do that. I'm not making that accusation, but that's exactly what the same logic model would do. And so I think it's time that we get back to talking about what happened, because vaccine hesitancy is an issue. I'm thankful that the vaccine was created. I'm thankful that it was developed and that for those that it helped. What is a big issue, and even a bigger issue, and certainly within the jurisdiction of this committee as a subcommittee of government oversight, is to make sure that our taxpayer-funded public health officials are not conspiring against the very people they're supposed to be serving. Time and time again, the American people were told by Dr. Fauci, Biden administration, to take the vaccine. And at the time, it was experimental at best. The data was very new. It was necessary. You know, there was emergency use authorization because we didn't know what we were dealing with. But then it began to be mandated on the people. People lost jobs. Suddenly, vaccine passports are made a reality. And if the shutdowns weren't damaging enough, we had medical people that were taken out of the industry when they were supposed to be helping people. These people, many of them decided not to take the vaccine, not because of the conspiracy theories or anything like that, but just because they had natural immunity. Many studies early on, or at least certainly a few months into it, gave us data that would lead that this was an issue that should have been concluded. I'd like to submit to the record an August 2021 study later published in the Journal of Clinical Infectious Diseases, which found that natural immunity offered up to 13 times more protection than vaccine immunity versus Delta, suggesting that waning vaccine efficiency and robust and durable immunity for previously infected persons. An August 2021 study published by the Journal of Science, which found broad antibody response from infection-derived immunity that protected against a wide variety of COVID variants. A September 2021 study published in Nature, which showed natural immunity offered as good or better protection against the Delta variant. A November 2021 article in The Lancet regarding natural immunity, which stated that protection from reinfection is strong and persists for more than 10 months of follow-up, and also asked why natural immune persons weren't given the same considerations as vaccinated people. A November 2021 response to a FOIA request by the CDC in which they stated they could not provide any documentation of naturally immune persons getting reinfected and then being transmitted to someone else. In a September 30th ABC article that was titled Hundreds of Hospital Staffers Fired or Suspended for Refusing COVID-19 Vaccine Mandates, that talked about President Biden mandating vaccines for healthcare industry. Dr. Makary, I'd like to ask you about the ethical concerns you have about the federal government mandating or compelling medical treatment that provides such treatment with financial, that the big pharma basically can benefit from.
It's really tragic because I heard from many parents who said, look, my child we're concerned about myocarditis. Maybe they had myocarditis in the past, and they're being told you still need to get the vaccine. They already had high levels of antibodies. A nurse who was going to get fired for not being vaccinated already had high levels of the antibodies that neutralized the COVID virus, but they were antibodies that Dr. Fauci did not recognize. And so we had 1 million people leave the workforce, and hospitals are understaffed. So Dr. Fauci, in early of 2022, sees the mountain of evidence out there on natural immunity, including the studies you cited, and he says, you know what, we've got to address this. A Biden administration official has a phone call with Dr. Fauci and 4 invited doctors, loyal friends of the Biden administration who supported mandates and restrictions, and they asked them, should we give credit for a vaccine if you had natural immunity? The vote was tied 2-2, and Dr. Fauci says, oh, you know what, we're just going to continue to ignore natural immunity. And we have the Yokovich doctrine that lives up until yesterday. Why would you put such a critical vote on policy in front of a straw poll of a couple like-minded friends?
That's tragic. Literally. I yield back.